Hello everyone, welcome back to Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shanaz and hope you all are doing great and enjoying this beautiful winter season with your family, friends and colleagues at home and even at workplace. Okay, so this short video is regarding a very important topic that we all must be aware of as healthcare professionals, especially those working in the emergency department, ICUs, first aid rescuers, emergency medical technician. And the topic is complications associated with CPR. Okay, so let's move ahead. But before moving ahead, a small and gentle reminder to all my lovely viewers that if you are new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. And thank you so much to all my wonderful viewers for supporting me. Okay, so let's start the complications that are associated with CPR. CPR, as we all know, cardiopulmonary resuscitation. It's an emergency life-saving procedure which involves the combination of chest compression and ventilation to improve the blood flow and oxygenation to the vital organs, especially the brain, when the heart has stopped beating. Yes, so we are doing the function of the heart, okay, till the person attains the ROSC. Okay, so though it is a life-saving procedure which helps to save the life, though it is a medical intervention which is very beneficial, which helps to improve the chances of survival of a person suffering from cardiac arrest, there are certain complications associated with it. Okay, so even this beneficial emergency technique has its own downsides. Okay, so even though if we follow high quality CPR, even though we do it meticulously, still there are certain complications associated with it which are sometimes unavoidable. Okay, so let's see what are they, and we all must have a sound knowledge of it. Okay, so let's see what are they. The first complication is aspiration and vomiting. Okay, so the chest compression, okay, that we are using during CPR, the person can vomit. It can induce vomiting. Okay, so it is the most common complications during the CPR, that is vomiting and aspiration. So as we all know that the person to whom we are giving CPR are unconscious. Yes, when we find the person unconscious and pulseless, not breathing, then only we give the CPR, right? So they are unconscious. That means they will not be able to clear the vomit on their own. So if we are not clearing off that vomit immediately, okay, using finger wipe method or suction, whatever, then there are chances that the person can aspirate that vomit. Okay, and this can block their airway. Okay, so this can block their airway and it can also cause infection. Not only vomit, sometimes the person can vomit some foreign objects like the victim's own teeth. Okay, and this aspiration can develop into complications like infection, that is aspiration pneumonia, which can even more complicate the condition. Okay, so aspiration and vomiting is the first complication that is associated with CPR. The next complication is broken ribs. Not only broken ribs, fracture of ribs and the sternal bones is again one more common complication which is associated with CPR, especially in elderly people, because their bones are very weak and brittle, and in those people with who are very thin built. Okay, so this complication is very common, that is fracture of ribs and the sternal bone. So the force that the victim experiences during the deep chest compression, okay, there is a possibility that the ribs can get fractured. Okay, and this is unavoidable, and this rib fracture, they can further damage the internal organs like the lungs, the spleen, the liver and all that. Okay, so pneumothorax, cardiac tamponade, all these are again complications that are associated with it. Fine, so this is one more complication that is associated with CPR. Then but still if we follow high quality CPR, we can avoid this, but sometimes it is unavoidable. Okay, then the next complication is internal brain damage or internal brain injuries. So as we all know that during the CPR, like the human brain, it receives 5% less oxygen than the usual time. In spite we are giving a high quality CPR, still the human brain receives 5% less oxygen than the usual time when the heart itself is doing it. And we all know very well that how sensitive our brain is to the supply of oxygen and glucose. Okay, so when there is a lack of glucose and oxygen, the brain cells, they are very sensitive and they start dying within 3 to 4 minutes. Okay, so internal brain injuries can occur, internal brain damage can occur because of the lack of this supply. Okay, and the brain can get affected. So this is one more complication that is associated with CPR, that is internal brain injuries. The next complication is abdominal distension. It is another more common risk that is associated with CPR. Okay, so when we are performing CPR, that is when the air is forced into the patient's lung, their abdomen becomes bloated and full of air during the CPR process, and this can cause the lungs to compress, making the process of ventilation difficult and increases the chances of vomiting. Okay, so abdominal distension is another complication that is associated with CPR. Okay, the next complication is what we say aspiration pneumonia, that we have already discussed. Okay, this can happen because of the vomiting. Okay, the person may aspirate the vomit. As we all know that vomit is what, the food content, right? Okay, and this food content, this can cause infection. Okay, it provides a good what you can say, a nutrition environment for the bacteria to grow, and not only that, the food content itself contains some kind of bacteria. Okay, and when this enters a wrong place, that is lungs, by aspiration, it can cause infection. Okay, and the person may develop aspiration pneumonia. And not only this, the person can also vomit foreign objects like the victim's own teeth. Okay, so this can also cause aspiration pneumonia. Then the next complication is tissue injury, soft tissue injury, and also injury to the internal organs, not only the soft tissue. See, the soft tissues of the victim's chest can get damaged from the pressure that we are using during the CPR. So it's all that, the chest compression that we are using to try to save the life of a person is causing all this complication. The force that is used during the chest compression, okay, this can cause soft tissue injury of the chest wall. Okay, and the person will have pain, after the CPR they will have pain, that bruising will be there. Okay, and not only these, the internal organs will also get damaged. Okay, the ribs get fractured, and those fractured ribs can further damage the lungs and the other organs, especially the spleen, the liver and all that. Liver especially gets damaged because of its close proximity to the sternal bones. Okay, so the internal organs also get damaged because of the force. So the person who receives CPR often needs further treatment at an ICU to promote full recovery. So as we all know that after performing the CPR, after we stabilize the person, the person does not get discharged or go to a room or ward side. They will be shifted to an ICU because post CPR they require a comprehensive post cardiac arrest care. Okay, which is very important for their full recovery. It's not that every person who is resuscitated will survive. Okay, and it's not that every person who is resuscitated will fully recover. Sometimes they get into these complications too. Okay, and they require an intensive care, okay, in an ICU. Okay, so they may face several problems like restricted mobility, cognitive impairment, restricted societal participation and depression. See, it's not just the physical complications that are associated with CPR. A person who's suffering from cardiac arrest and receiving CPR is a person who has experienced a near death situation. Okay, just imagine guys, they have faced a near death situation. So post CPR it is very common that they may get into depression. Okay, some mental complications are also there. Okay, so they may get into depression, they may face anxiety and stress, okay, post CPR, because they have experienced a very near death situation. Okay, so a comprehensive post cardiac arrest care is very crucial in an ICU to help the person to fully recover. So though there are complications associated with this life-saving technique, still it does not stop us from performing it to save the life, because saving a life is more important than the complications can be later on dealt with. But still, if we follow high quality CPR, the 5 components of the high quality CPR, we can reduce these complications to some extent. Okay, and sometimes they are unavoidable, but still we can reduce, okay, by following proper high quality CPR components. Okay, so these were some of the complications that are associated with this life saving procedure that we must all be aware of and taken care. Okay, so hope you found it helpful, and thank you so much for watching it. Okay, hope you found it helpful. If you found it helpful, then please do subscribe and like and share my videos, and keep smiling, stay strong physically, mentally, spiritually. Okay, and help others always. Okay, and try your level best to be a better version of you each and every day. Okay, thank you guys.